possible constitutional defects in the health care law recently signed by President Obama. The statute has many very odd parts to it that are all subject to challenge, like the federal takeover of student loans, the creation of a health care army, which includes members of the state's National Guard, and the hiring of 16,000 new IRS agents. But the main constitutional violations address what the Congress has ordered the states to do and what it has ordered individuals to do. These unconstitutional and troubling provisions order the states to increase state taxes and spend the money collected on health care, order individuals to acquire health insurance that provides coverage acceptable to federal bureaucrats, transfers regulation of health care from the states to the federal government, and puts a federal bureaucrat between patients and physicians. Question: can the federal government tell the states how to spend state-generated tax dollars? In a word, no. Recall that the states formed the federal government and not the other way around. When they did so, they gave away only 17 specific powers, all written down in the Constitution, and they expressly retained for themselves what they didn't give away. At the time the states formed the federal government, they were independent nation states, and the powers that they gave to the new federal government were aspects of nationhood, such as raise an army and navy to defend the country, operate a court system, provide for standard weights and measures, coin money, and run a post office. These are all aspects of nationhood with which the states would no longer be concerned. But the states retained for themselves the power to legislate for the health, safety, welfare, and morality of people in the states. The federal government simply has no authority under the Constitution to regulate in those areas or to tell the states how they should do so. Now, the president has argued that the power the Constitution gives to Congress to regulate interstate commerce permits it to regulate health care. Question: when you go to your doctor, is it for a commercial purpose or is it to enhance your health? The power to regulate interstate commerce was given to Congress so it would keep commerce between the states regular by eliminating state tariffs. It was not given to regulate purely local professional services like visiting a doctor. Can the Congress regulate a Tupperware party? Of course not. Since the federal government cannot tell the states how to tax and regulate in the areas reserved by the Constitution to the states, since the regulation of health care has been done by the states for the past 200 years, it follows that the Congress cannot order persons to purchase health insurance. The Congress can't order us to eat or to wear shoes, even though those are both beneficial to us. So how can it order us to buy health insurance as well? The Supreme Court has held that the most private of our conversations, and thus the one most insulated from government intrusion, are those between a patient and a physician. Yet the statute just signed by the president violates that right to privacy by requiring physicians to share private medical information with federal bureaucrats, and by permitting those bureaucrats to direct the physicians how to treat the patients. The government cannot run the post office. It can't run Amtrak. It has bankrupted Medicare, Medicaid, and Social Security. Can we really expect it to manage health care? The Congress that enacted this monstrosity recognizes no limits on its own powers. It does not take seriously its oath to uphold the Constitution, and it acts like it is a general legislature that can right any wrong, regulate any activity, and tax any event. That is 180 degrees from the values of inalienable rights and limited government that the framers gave us.